Thanks for joining us today. So
Yeah, thanks.
this is our second interview in the Founders series that we're doing for HealthTech Arkansas, where we're talking to different founders about their companies and entrepreneurship in general, and accelerators and all that good stuff. So,
Awesome.
so we appreciate you taking time to join us. So, I guess maybe to start off, you're part of the HealthTech Arkansas cohort this year in 2019. You're one of 6 companies that we're working with. We're bringing those companies to Arkansas to connect them with our hospitals here inside the state and one large physician practice to do pilot projects with us. So maybe a good place to start is maybe you can just give us a quick little elevator pitch on what HealthNote is about and what you guys do.
Sure. So HealthNote's an AI platform helping to improve patient encounters by gathering pre-visit information and creating a doctor's note. So we enable physicians to optimize time by confirming information instead of spending time exploring and documenting.
Great. Super. So I think it would be good for the audience to get just sort of a little bit of your personal background. Maybe tell us kind of what your background is and how you kind of led up to the point where HealthNote became an idea for you.
Sure. My background's in internal medicine. I started my first digital health company when I was in my residency training. That was about 4 years ago. And HealthNote really came about from the experiences that I had working in the clinic.
That's right. And it seems like to me, like most or a lot of good ideas that happen about, you saw something in your practice that you said, gosh, there's got to be a better way to do this, right?
That's exactly right. So I was working as an internal medicine physician in Tucson, Arizona. And I was working at a really awesome organization. All of my patients were great. They were Medicare age, so that means they were over 65. And while I loved seeing them, I found that I was spending an extraordinary amount of time gathering information from those patients. They would often come in and think about what their problems were, or have to call a family member during the visit, or have to go through a bag of medications to tell me what they were taking, or look through their bag and be able to tell me what doctor they had seen. And I realized that instead of spending quality time examining them and treating them, I was spending an extraordinary amount of time just in this dialogue of information gathering. And I thought, exactly as you said, there's just got to be a better way to collect all this information before a visit. At the time, I was still working part-time on my last startup. I had joined Y Combinator startup school, and that's where I met my current co-founder. And Aaron, my co-founder, has a background in enterprise big data, and he was working on a separate startup. And we really just became friends. We were consulting on each other's companies. He was not working in healthcare at that time. And we'd sort of toss around startup ideas. And after about a year of knowing each other, I was complaining about some of my frustrations that I saw in the clinic. And about staying late after work and spending so much time writing notes. And Aaron says, hey, I think I can help you. I said, all my patients, they're 65 and above, and I'm not sure how you're going to be able to help. He shows me some prototypes, we iterate, and in about a week, I'm like, I need this in my clinic. This is awesome. Let's go see if anyone else cares about this. And a month later, we had our first paid pilot, and basically the rest is history.
Wow, that's great. So how long ago was that?
So that was about a year and a half ago now.
Okay. And at some point in there, you thought, I need to jump into this full time, right? Was that a tough decision for you? What are the things you evaluated when deciding to leave medicine full time and plow 100% into HealthNote?
Yeah, it took probably about 6 months. It was definitely a difficult decision. After we got some funding, that's when I ended up going full time.
Yeah, that makes sense. And you guys have accomplished a lot in a year and a half, for sure. And I know that one of the things that our providers here were really intrigued about HealthNote and is why you had such a strong endorsement of providers here who wanted you to come to Arkansas and work with them, is the ease of communication with patients and the fact that patients will show up to their appointments and now there's a note that's already been written. It can be incorporated straight into the EMR. So it really helps from an efficiency and time standpoint. But I also think it would be helpful for you to talk about how else it can help. But because I can't imagine that that patients who are engaged in this way, first of all, they have probably a lower no-show rate or cancellation rate if you engage with them, and maybe even better outcomes, clinical outcomes down the road. So what are your thoughts on that?
Yeah, so we've seen almost a direct correlation. If someone fills out our entire questionnaire, they almost 100% of the time show up to a visit. Because if someone has spent somewhere between 7 and 15 minutes to give this information before a visit, chances are they're showing up. So yeah, there's a direct correlation between those two items. In terms of return on investment from the organizations that are using us, we found that not only is it saving time, but we're also helping collect information that normally just wouldn't have been collected because there wasn't time to do that. Yeah. So it's really helping streamline various different operations in the clinic.
Yeah, and the fact that this information is being gathered on a chatbot without human intervention, it was really remarkable to me. I just know myself when I did the demo, and I don't consider myself a strong techie by any means. I was just so surprised at how fast I was going through that app and inputting my own information. So you guys have obviously spent a great deal of time making it as user-friendly and as intuitive as possible.
That's absolutely right. So we've spent hundreds of hours with multiple different demographics, but actually when we just started with actually a couple of hundred folks that were above the age of 65 and sat down next to them and watched how they interacted. We realized right away that if you made them download an app, they were not going to do it. If they had to sign into something, they weren't going to do it. So that's why we really focused on making a frictionless platform. So patients get a text message several days before a visit. They tap on a link. It opens up our platform, and that's it. The font is huge. There's contrasting colors. It's just really, really simple for folks to use. We took a very, very user-centric approach there. And we found that there's absolutely no replacement for actually sitting next to the users and watching them, just their hesitations and hand movements, et cetera, to make it as simple as possible for them to use, and making it sort of patient-friendly language, and then translating all of that into physician usable language is, I think, a big part of our value.
Yeah, no, I completely agree. When I was doing the demo, I thought to myself, my 88-year-old mom, who's even probably less adept on a smartphone than I am, I think she could probably do this. She's been an iPhone. I really think she could input her information on this. I mean, it was that easy.
Absolutely. My dad was one of the earliest testers. He's 74. He has Parkinson's, so his left hand shakes. And he just gave us fantastic feedback. He didn't know where to type at first. So we made a little arrow that just points down to where folks need to type. All these very simple things. Normally it would take him 20 minutes to send me an email. And so to get him to be able to use this without any difficulties was, a real accomplishment. And we saw that really just translated. And we just continued to refine that process with all these folks that we tested it with.
That's great. That's super. So, as I've mentioned, you all have made a lot of progress in a year and a half. As you think about your next milestones as a company and the things that you all want to achieve, what do you see as some of those milestones, and how do you think HealthTech Arkansas can potentially help you get there?
Yeah, it's a great question. So, for the first year, we were really trying to refine the product, make sure it was usable, get actual patients testing it. Now we've done much more than 10,000 with some smaller clinics. And so our initial focus was really working with small clinics. And, in the past 4 or 5 months or so, we realized that hospitals are also really interested in what we're doing. And that has really been our shift in focus, and our milestones are really getting large hospitals and large healthcare organizations on board with our platform and integrating in with their systems. We're working on 7 different pilots with top hospitals around the country, and that includes some really awesome organizations in Arkansas. And so with HealthTech Arkansas, I think the really awesome thing is that it's helped cut through a lot of the red tape in terms of talking to organizations and being able to set up pilots so we can actually work with, again, larger organizations, not just small clinics. So that's really where we're at right now.
Yeah, I think so. I think that, hopefully that is one of the benefits that our program offers. And we've heard that from other entrepreneurs as well, which is, working with hospitals is not an easy thing. I mean, they're busy, complex places, and they have people calling on them all day long. So to take the time for any of them to deal with an early stage company is even more difficult, right? So
just getting the meetings in general are difficult, right? So as you said, priorities are constantly shifting, and there are multiple priorities at a large organization. So just being able to sit down, get feedback from some of these organizations is value unto its own.
Yeah. So just in full transparency, we'd love to know, what are your impressions so far of our providers here in Arkansas? Are you able to meet with them, talk to them, engage with them with the way you had hoped at the beginning of the program?
They've really been awesome. So I had never been to Arkansas before. It was much greener and mountainous than I had imagined.
And
I'm not
hotter,
sure what I
maybe.
imagined, but it was definitely hot when I was there in the summer. But it was really beautiful, and actually, the people there were just really warm and nice and inviting, and it had this kind of small town feel, even though it was a fairly fair-sized city. And the hospitals and the folks that we met with at the hospitals sort of made it feel the same way. One of the organizations that we're piloting with, the chief technology officer there drove me home from our interview there. That wouldn't have happened in LA or New York, right? So
right.
Just to give you that as an example, just the folks have been really accessible and great to work with and talk with. But I think just that example alone is like, he wouldn't let me take an Uber home. He said, back to the hotel. He said, no, I'm going to drive you. And that kind of stuff just doesn't happen.
That's fantastic. Yeah. We're a collaborative state. And I think that's definitely one of our strong points is we all know each other. We work well together, and we want to help people. So, all right. So let's switch gears and talk about maybe entrepreneurship in general. I was struck this year that of our 6 companies that came into the cohort, we didn't plan it this way, but there just happens to be, of the CEOs, there are 4 MDs and 2 PhDs among our 6 founders. I suspect that there are a fair number of clinicians like you around the country who have ideas for better ways of doing things, right? And they're sitting there trying to think about how should I pursue this idea? Should I pursue it at all? If so, what are the steps I should take? So I was just thinking about whether you had any sort of advice or guidance to people who may be sitting in that position and considering entrepreneurship, because it's a really big decision. And how did you safely make that transition for yourself, and what advice would you give to other people, considering the same thing?
Yeah. So in general, I'd say it's relatively rare for physicians to completely leave their jobs and jump into entrepreneurship, especially in digital health. With medical devices, it's slightly different. They can continue to work and sort of be chief medical officers, et cetera. But as founders, I haven't seen too many physician founders. And at HealthTech Arkansas, I think it's actually pretty interesting that it happened to work out that way, that there are so many physician founders. But yeah, it's really hard to make that jump. For me, the way I felt was that I didn't feel that anyone who wasn't a clinician was able to solve the problem that I was trying to solve. And that if I didn't go out and do it, it wasn't going to happen anytime soon. And I didn't want to practice medicine if that problem still existed, if that makes sense. So for me, it was kind of this burning desire of, hey, I love talking with these patients, but these inefficiencies, it really causes you to burn out. And when you're burned out, you just don't give as good care. And so if we can, that's not the only cause of burnout, but optimizing clinic workflow and having sort of more quality time with patients, I think is overall just better for patients and physicians. And so yeah, to make that jump is not easy. You have to really, really want to do it because you have an idea, but you can't do it alone for the most part. There's
Right.
very, very few people who can do this kind of thing alone. And in healthcare, you really just need to have a collaborative effort. It's basically no one does this alone. That's why I'm sitting here and talking to you, right? And that's why, healthcare in general, you really just need to collaborate. And so getting a team together is really difficult. Very often physicians are really in their own world and they're talking mostly with other healthcare related individuals. And so to find, technical folks who speak the language that you speak and can understand and can translate your ideas into reality, really, really difficult. There's some clinicians, and now there's some programs actually trying to get clinicians to become more technical so they can kind of do this thing, but it's hard to do everything on your own. You really need to collaborate with folks. And the truth is you cannot do this part-time. You can start part-time, but it does not work. This is not a part-time gig. You cannot run a and then see patients on the side. It just doesn't work. So it's a really difficult decision to sort of make that jump, but it's a big decision, not an easy one.
Yeah. You put yourself in a position, for example, with the Y Combinator Startup School to meet a technical co-founder. And that maybe is the good formula, right? Which is if you really have an idea that you think is worth exploring, is to put yourself in those kind of positions, enroll in those kind of programs and incubators and, pitch competitions and all that. Just put yourself in those kind of audiences where you meet technical folks.
Exactly. You just have to get yourself out there. My first sort of jump into entrepreneurship was in Tucson, Arizona. I joined Startup Tucson, which is a small local organization. And I would not be here today if I didn't go there. There's absolutely no way. Going to these meetings and joining some programs that they had, joining a startup weekend where I had an idea, joined a small team, and sort of started learning from there. You have to start somewhere, whether you started in college or finding a local organization. Everyone does it kind of in their own way, but that's the way I did it.
Yeah. Very good advice. Entrepreneurship is not easy, even when you do have a fantastically talented technical co-founder like yours, and you put together a great team that you have done at HealthNote. It's still not easy, right? There's barriers and challenges along the way. I know that because HealthTech Arkansas, we're our own startup in getting this program off the ground over the last 2 to 3 years. So what are some of your bigger challenges that you've had, and how did you deal with those, and how did you overcome them?
Yeah, the challenges are coming all the time, right? So 4 months ago, we were 2 co-founders and a couple of part-time people. Now we're 11 full-time people and now several more part-time people. So there are new challenges every day with onboarding folks and getting everyone up to speed and doing things the way you sort of expected to be done. And then also just in general, just having a good balance between your team, but also just in life, right? Because a lot of us who get into entrepreneurship, especially if you have a healthcare background, you're used to working 80+ hour weeks, right? And then you translate that, and when you're really passionate about something, you continue doing that. And so finding a good balance between sort of what you're working on, delivering to customers, making sure they're happy, but also, making sure you take care of yourself as well, so you can continue to deliver for customers. It's an ongoing challenge, and ongoing trying to figure out how to make that best work. Really, it's always a delicate balance.
Sure. Do you feel balanced? Do you feel balanced?
I am continuously working on becoming more balanced.
Fair enough. That's outstanding.
I'm living in Los Angeles now. I bought an electric bike, and about a week ago, I went on a 30-mile bike ride to the beach. So always trying to do new things to just feel a little bit better also and get that balance. So,
that's great. That's awesome. So I guess my last real question for you is, there are a number of founders all the time who are evaluating different accelerators and different programs to enter into. There's always a trade-off between, as a founder, and what you're giving up versus what you anticipate getting as part of that accelerator process. So, for digital health founders out there, what advice do you have for people just evaluating different accelerator programs out in the country?
Yeah, there's lots of different ones, and I've now either very closely observed or been a part of a couple. They each have their own values. Every one of them that I've been either associated with or observed has been incredibly valuable for different reasons. For HealthTech Arkansas, it's definitely unique, and for me, a no-brainer for someone to apply to. You actually have absolutely nothing to lose. We spent a few days in Arkansas, and I'm sure I'm going to be coming back to Arkansas to work a little bit closer with some of the organizations that we're piloting with. But having the opportunity to pilot with some of these organizations, even if it didn't go anywhere, right? Even if you didn't end up piloting with them, just having the conversations with them is worth your time. There's really no downside. And so for me, it's kind of a no-brainer for folks who are interested in working with a new market, learning new things all the time. I'll tell you right now, one specific example that I would not have thought about, but I'm sure will come up with our product in particular. We gather patients' address information, and we use Google to help gather some of that information. And right away, we were talking to folks, and they were like, well, a lot of our folks have mailboxes on the side of the road, and they don't have addresses like this. So how are you going to put that in? And I'm just like, never would have thought of that, Yeah. So all these like little things that are different. So always learning, right? And so it's a fantastic opportunity to learn. And the goal, of course, is to pilot and turn these pilots into contracts and really help our company, but also help the organizations in Arkansas get access to really awesome startups. So for me, it's really a no-brainer.
Yeah. Well, thank you for saying that. We have found that as well, that there's just a really strong value proposition going each way, because as valuable as these pilots are for companies like yours, where you can go in and demonstrate value to a provider and hopefully translate that into a commercial contract, there's just as much value for our providers, right? I mean, they're just seeing we are able to bring the best early stage companies to this program. And that's why our providers just keep coming back year after year, as they like the technologies you guys are bringing them. So,
I think, in Little Rock now, there's the same technology that's in San Francisco, New York, and Boston, right?
That's right.
And actually, I was amazed to see how open everyone was to the new technologies and really enthusiastic about it. I'm not sure what I expected, but they were actually less hesitant than in many other places. So it's been great.
That's awesome. All right, cool. So viewers who are watching this, how can they find your company and learn more about you and connect with you if they're interested?
Yeah, so our website is healthnote.com. Just the word health and note together.com. And my email is josh@healthnote.com. And that's probably the best way to reach out to me.
Awesome. Well, thanks, Josh. I really appreciate it. This has been fantastic. You're an easy person to interview.
All right. Well, thanks so much.